A pressure injury is localized damage to the skin and/or underlying soft tissue, usually over a bony prominence or related to a medical or other device. Pressure injuries are more prevalent in individuals with certain risk factors, such as poor nutritional intake, unintended muscle loss, immobility, skin exposure to urinary or fecal incontinence, cognitive impairment, or chewing or swallowing difficulties. Pressure injuries are classified into 4 main stages, but occasionally a pressure injury is unstageable or there is a deep tissue injury and the depth of the injury is unknown. The healing process for a pressure injury is dynamic and may be affected by the overall physical condition of the patient. In a typical, healthy individual, the 3 healing phases for a pressure injury are inflammation, proliferation, and maturation. Depending on the patient's individual circumstances, including their nutritional and health status, these 3 phases may progress both backwards and forwards. During the inflammatory phase, the blood vessels surrounding the injury contract and form a clot. Once bleeding stops, blood vessels dilate to allow nutrients, white blood cells, enzymes, antibodies, and other needed growth factors to proliferate the injured area. During the proliferation phase, the pressure injury begins to fill with collagen and other extracellular elements. This allows new blood vessels to develop, supplies oxygen and nutrients to the injured area so that it eventually closes. During the maturation phase, the collagen within the closed injury strengthens, and the skin's discoloration slowly disappears. These are the healing steps for a typical, healthy individual. When the health and nutritional status of a patient is compromised, healing for a pressure injury many times does not progress as planned, and the injury becomes more advanced. When a pressure injury is present, it is important that a proper care plan is followed to help the injury heal. One important component to pressure injury healing is consuming the appropriate nutrition. The most important nutrient component for pressure injury healing is protein. Protein is the main substrate necessary for pressure injury healing and can help offset protein losses. Protein is responsible for synthesizing necessary enzymes for pressure injury healing, cell multiplication, and collagen and connective tissue synthesis. Arginine is another important nutrient for a pressure injury to heal. Arginine supports pressure injury healing since it's a precursor to nitric oxide, which causes blood vessels to open wider, increasing blood flow. This increased blood flow can support collagen growth to fill and strengthen the injury as it heals. Like arginine, citrulline also supports the healing of a pressure injury. Citrulline transforms into arginine through the same biochemical process that produces nitric oxide. Consumption of citrulline can raise plasma arginine levels more efficiently than supplemental arginine because it bypasses intestinal and liver breakdown. Citrulline increases nitric oxide production, supporting blood flow and collagen growth. Vitamin C is essential for connective tissue and collagen synthesis. This vitamin also supports the formation of new blood vessels and enhances activation of leukocytes and macrophages to the injury to promote healing. Zinc is a trace mineral and is essential for DNA synthesis, cell division, collagen formation, protein synthesis, and immunity. All of these functions are necessary for regeneration and repair. No evidence exists to support consuming a megadose of vitamin C, zinc, or any other vitamins or minerals to assist with the healing of a pressure injury. However, many adults do not eat a well-balanced diet and may have difficulty getting the extra protein and nutrients they need to heal a pressure injury. It's easy to get the necessary protein and nutrients needed for pressure injury healing by consuming ProStat Advanced Wound Care. ProStat Advanced Wound Care is a concentrated liquid protein medical food that contains 17 grams of protein per fluid ounce with added vitamin C, zinc, arginine, and citrulline. The healing of a pressure injury is a complex process that involves following a distinct regimen of care. Eating the right nutrients can be instrumental in helping a pressure injury heal. However, nutrition is only one part of the complex healing process for the pressure injury to heal. The overall physical condition of the person and the local pressure injury environment directly influences the progression of the healing process. For more information about which nutritional products can help with pressure injury healing, visit www.specializedadultnutrition.com.